This episode is brought to you by Trillium Aesthetics. Let's face it, the weird look is having a moment. When you look around at celebrities, strange-looking eyes, overfilled lips, puffy cheeks, and faces that don't seem to move at all are common. You've probably started seeing this around you at the store or when you're out with your friends. Trillium Aesthetics is the place to go for non-surgical treatments that keep people wondering, did she have something done? What does she do to get such beautiful skin? The team at Trillium Aesthetics prides itself on results that whisper but don't shout. If you're looking for non-surgical treatments to brighten up a dull winter complexion, add a little pout to your lips, or erase some pesky smile lines, call the team at Trillium Aesthetics. Schedule online on their Instagram page at Trillium_aesthetics or visit the website trilliumaesthetics.com. Welcome to the Trillium Show, where we help you make the changes you want to see in your body, in your mind, and in your life. I'm your host, Dr. Jason Hall.
Sometimes people think that after plastic surgery, you should come out of the operating room looking like a finished product, looking like the before and after pictures that are on the website or up on social media. And I think it's important to remember that the pictures on social media, the pictures that are on a website, are typically at least 6 months out, usually more like a year or longer out from surgery. And that is because during the healing process, things look weird. Things just have an odd appearance to them. And breast surgery, specifically breast lift and implants, tend to have a really strange appearance right after surgery. And if you're not expecting that, then it often can lead to a great deal of panic because you think you've done something that has gone terribly wrong. The appearance after breast lift with implants, specifically after breast lift with smooth implants that are placed under the muscle, is fairly uniform. At least for my patients, they tend to have a uniform appearance right after surgery. The implants sit high. They kind of are very, very full and round at the top. The nipple-areolar complex looks kind of something like Madonna would wear back in the 90s. It's very pointy and unnatural looking. Additionally, because the implant is high riding, it kind of forces that nipple to point down to the ground. And so it looks like kind of a half lift has been done instead of a full breast lift. And when women take their bra off the day after surgery and see this kind of exaggerated appearance that gets worse over the next 2 or 3 days, they rightly freak out, get worried that something is wrong. And this show, this little kind of mini show, really is to let people know that healing after plastic surgery takes time. No matter what it is, whether it's a rhinoplasty, a facelift, eyelids, tummy tuck, breast surgery, it takes time. And the first 48 to 72 hours are going to be when weird kind of peaks. Everything is going to look weird. You're going to be the most swollen. You're going to be the most puffy. You're going to be the most sore. Well, what you notice on day 1 after surgery tends to get worse over those next 2 to 3 days. Unless you have a hematoma, unless you're having a problem, and we want to hear about those things. But swelling, symmetric swelling, and turning down of nipples after breast surgery in those first couple of days is completely normal. Now, with breast surgery, one of the disconcerting things that can make people a little bit nervous is that it does take some time for that swelling to go down in the upper part of the breast above the nipple. It takes some time for that implant to relax and kind of settle back down where we put it right after surgery. And so what takes a day to happen between surgery and when you wake up and look at it, and then that appearance that you see the next day, it can take weeks for that to settle down, for those implants to drop. A common phrase that's heard on the internet is dropping and fluffing. I really think that's a good descriptor, but it kind of gets the point across that those implants do change and will change over the course of the first 6 weeks to 3 months. So be patient. If you have a high riding implant right after a day or two after surgery, and they both look like that, not something to worry about. If you're concerned, by all means, give the office a call. Call me if you're one of my patients. If you're not one of my patients and you're listening to this on the internet, call your surgeon, and they should be able to kind of walk you through that, look at pictures, even have you come in and examine you if necessary. Hope you've enjoyed this. Stay tuned for more great content coming your way.
Thanks for listening to The Trillium Show. You can keep up with the latest on the podcast at jhallmd.com. Be sure to follow us on Spotify, Apple Podcasts, or wherever you listen to podcasts. If you want to connect with us on social media, you can find us at jhallmd on Instagram and Twitter, and Dr. Hall Plastic Surgery on Facebook. Remember, be the change you wish to see in the world.